Thank you so much for watching this quick bit of learning intramuscular injections in the dog and the cat. My name's Amy Newfield. I'm the owner of Vet Team Training. And one thing that we are very proud of at Vet Team Training is we don't just show a quick video. No, we want to make sure you truly have the knowledge of the why and the how so that you're able to do the procedure. So let's go ahead and get started. So there are four locations of intramuscular injections in both the dog and the cat. Quadriceps, which we don't really use that one. I put it in there because it's in textbooks, but I want you to understand it's pretty much not done, and you're going to see why. Triceps, also not routinely done, and we're going to show you why. Lumbar, the apaxials. So this has probably become increasingly more common in the last 10 years. And I'm going to pause and tell you, I'm sorry, but that's the only thing I have videos of is the lumbar, the apaxials. And one of the reasons why that is because whenever I'm filming, first of all, it's an honor to film other people doing procedures. So everything's done on, veterinary patients in veterinary hospitals. In most of the veterinary hospitals that I record at, guess what? They're doing 90% lumbar or apaxial actual injections. And I think that probably is the scariest one, but it's also the easiest one to do. So I really wanted to dive into and show you how to do that one, because if you can do that one, well, then everything else is super easy. Semi-membranous and semi-tendinous, that's also probably the second most common. In fact, that one was used a lot more frequently until people started becoming very comfortable with the lumbar, also the apaxials. All right, so let's show you what this looks like. So these are my own pets. This is Levi. He's a 2-year-old Siamese. He's getting fed churu. And I'm going to show you the landmarks on a cat. And then I'm going to show you on my border collie Havoc, who's 12 years old and much better behaved than a cat. So let me go ahead and get started. So first and foremost, this is going to be the semi-membranous or the semi-tendinous. And I want you to notice that there's several different ways to do this. I was trained to pinch off the femur. And so let me grab my laser pointer, just give you some anatomy lessons. And again, this is why we're very different, because I could just show you a video, but you need to understand the anatomy. You've got the femur. It's the largest bone in the dog and cat, and actually the human being as well. So we've got the femur here. On the back side of the femur is a sciatic nerve, okay? So it runs parallel along with the femur. Now, some of you know what the sciatic nerve is because you have sciatic pain. We don't want to hit the nerve, so we need to stay away from it. So if you pinch where the femur is, well, then all of this over here is free game, right in his bum. The semi-membranous, the semi-tendinous, it doesn't matter which one. You're going to put it in somewhere over here. But you really do want to know where the femur is. So pinching off the femur is going to tell you, okay, the nerve is somewhere around here as well. And this is where you're allowed to go. So arguably, that's how I was taught. That's how I continue to do it. I know there's a couple different ways, but essentially you're going to want to go ahead and put it over here. So let me go ahead, dock my little laser pointer, and then let's press play. All right, so yep, right there, just away from that nerve. Here you go, feel the femur, pinch it, stick it in his bum, okay? Now this is why I'm gonna pause. I'm gonna grab my laser pointer again, okay? So this is the quadriceps, and arguably there's other muscle beds up here. The reason why we don't tend to do it is it's a very small, thin muscle. You're dealing with a cat. And you're going to pinch off the femur, same rules apply, but you're going to want to go into a much smaller muscle bed. And because of that, we're not comfortable because you could hit the bone, you could hit something else. Yes, can you do it? Sure, but nobody really does it. And so what does that look like? Here we go. You're going to pinch off the femur, grab it, tiny little muscle, very tiny muscle up there. So again, that's the quadriceps location. Now he's getting fed churu, you can tell. Let me just go ahead, grab the laser pointer, give you some landmarks, okay? So we have the humerus coming down. That's the shoulder blade. So we've got the shoulder blade here. Same rules apply. If you're able to pinch off the shoulder blade, well, then the triceps is going to be over here. So we're going to be looking for triceps over here. Let me go ahead and grab that, dock that laser pointer again, push play. So this is what this looks like right here. Yeah, we're going to pinch that off, grab a hold of that nice long bone, and you're going to go back here. And now this is the one that's become increasingly popular. So this is the lumbar, also the apaxial muscles, basically. So your spine Obviously, we've got some vertebrae here. And in between the vertebrae, that's the scary area, right? So we don't want to hit the vertebrae. The vertebrae has your spinal cord in it. So it's really important we know where the vertebrae is. But on either side of the vertebrae is these wonderful muscle beds, and it's super easy to go into. And arguably, I would say for cats, it tends to be one of the easiest places to go because cats really don't like their hind legs or their front legs touched. This is also a really nice large muscle bed. And so the two probably largest areas for muscle beds are going to be that semimembranous, semitendinous area, as well as the apaxial muscles, which lie on either side of the actual vertebrae. Now, oh, let me keep my laser pointer. So we have, oh, nope, I put it away. Hang on, guys. We've got thoracic vertebrae. That means your chest cavity. And then you have your lumbar vertebrae. And most textbooks are going to tell you that lumbar vertebrae, you want to go between lumbar vertebrae 3 to 5. Essentially, if you start coming down here, you're going to feel the hip bones. Don't do it down there. And if you start coming up here, you feel ribs. So don't do it there either. So go somewhere around the middle of the back. That tends to be safe. Not a lot of people count out the vertebrae, but textbooks are going to tell you between vertebrae 3 to 5. In fact, I did find a reference that said 2 to 5, but essentially go in the lumbar vertebrae. Okay. All right. So what does that look like? Well, a lot of people also use the L, and we're going to talk, I'll show you what that looks like. Here's the L. Let me pause for effect. Let me grab my laser pointer again. Okay. So what happens is you put your finger on the middle of the vertebrae, and then in the L, right around here, that's where you're going to want to go. This means I'm protecting the spinal cord. Okay. I'm protecting the spinal cord. I want to go to the apaxial muscles on either side of the lumbar vertebrae. All right. So what does that look like? Yeah, right there. Perfect. Beautiful. How does it now? He's being a little squirmy. He's like, "What are you doing?" I'm like, "Please pay attention. Don't be a pain." So there you go. Now let's look at a dog, much better behaved. All right, so we feel for the femur. He's got a big honking femur. We're gonna pinch off the femur. Here it comes down, pinch it off, smack him in the bum, okay? Now let's see. We're gonna go ahead and go for that quadriceps, which we don't really love as much. Pinch off the femur this way. There's the femur, and we're gonna go right in there, okay? And again, much smaller muscle bear. There's my other dog, Blitz. He's checking out things, by the way. All right, triceps. Can we go triceps? Sure, we can. His poor little face. All right, we're gonna go ahead, grab onto that humerus bone, that really long bone. Pop that right in there. Okay. Well, the reason why we don't do it, it's not that big of a muscle. It's definitely bigger than the quadriceps. The triceps is definitely bigger, but certainly not great. Let me just pause so I can catch up with the video. We don't usually love the front leg. Animals tend to be more reactive. All right, so now we're in the lumbar vertebrae area. So again, doing that nice L, you want to go far away. If we do it from this side, it's going to be over here. And we're going to feel, making sure, again, between that, basically that 2 to 5, if we can, or 3 to 5 lumbar vertebrae. So again, I'll go ahead and just play havoc one more time. Get back here. We're going to pinch off the femur. Why do we pinch off the femur? Now you know there's a sciatic nerve that runs along the side of it, and we're going to smack them in the bum, a very popular site as well. Put it right in there. We're good to go. All right, we come up. We're going to go to that wonderful quadricep area, which honestly, I don't even know if I've ever used it in vet med. Just don't use it, basically. I put it there because textbooks tell you about it. Blitz is making sure he's not part of this demonstration. All right, then we're going to come up. We're going to go to the tricep area. We're going to pinch off that beautiful humerus. We're going to pinch off that huge shoulder bone. Come down, pinch it off. And then you're going to pop it in his tricep. He's got beautiful triceps, but he runs with me every day about 5 miles. He also does agility for a 12-year-old dog. Come down, make sure you feel your spinal cord. Well, not the spinal cord, but the vertebrae. You do the L technique. There you go. Some people will pinch off and just go to the side. That works as well. So yeah, those are your landmarks. That's what you're looking to do, basically. Okay. So let's talk about the risks. There are some risks with any type of injection. It doesn't matter whether or not it's intramuscular, subcutaneous, or IV. There's always going to be risks. Big one is infection. We are taking, hopefully, something sterile, and we're going to put it into the muscle, but it's going to pass through skin and fur. It's going to a little bit come in probably contact with the air. You also, I'm going to pause. One of the things you have to understand is you want to use a new needle every single time. So that means if you went went through, let's say, a bottle, like a fluid bottle of any sort, you want to change out that needle. The only time you can't do that is insulin needles. Insulin needles are kind of pretty much welded on. It's part of the plastic. You can't take off the insulin needles. So unfortunately, most of the time with that, you're going through subcutaneous layer. Can you give insulin? I am, yes, but obviously with our owners, and 99% of the time, you're going to go sub-Q. So you can't change out insulin needles, but everything else, you're going to go into whatever bottle, draw up whatever fluid, vaccine, whatever it is. Vaccines go sub-Q too. I don't know why I mentioned that, but in any event, whatever you're drawing up, going to give it IM. Yes, absolutely. You're going to change out the needle. And by the way, even for vaccines, even though they're going sub Q, you want to change out the needles. Just use one needle one time and get a new needle. Don't be cheap. They're really inexpensive. All right. So infection's always a possibility. Now, one of the big questions we get asked, should we put rubbing alcohol, 70% isopropylene alcohol? Honestly, we don't tend to do that anymore. One, you're going to pass the needle through the alcohol, and two, the problem is it's not probably going to do much. You're not going to get it down to the skin layer. Now this animal has a whole bunch of alcohol. Cats hate it. Cats absolutely hate it. It's cold. They don't like it. So in veterinary medicine, we don't tend to use it. Now, some textbooks still advocate it, but honestly, the disinfection time for isopropylene alcohol of 70% to do anything, we're talking minutes. You have to give this injection, and you don't want this animal to, first of all, you got to get it down to the skin, really rub contact onto the skin and the fur, wait a couple minutes, and then go ahead and inject it. It's not practical. So I will tell you what textbooks say, but then I'm also going to tell you what really happens in vet med. So infection is always a possibility. Certainly it's minimal, but it's a possibility. If the patient moves, guess what? Laceration of the muscle, the tendon, the vein. Yeah, if your patient moves really quick and that needle's in that patient, you can do some damage. Absolutely. Accidental intravenous administration. We're going to talk about how we prevent that. Accidental spinal injection. Ooh, ouch, right? Nerve injury. And it's not just the nerves in the spine that we're talking about. We talked about the sciatic nerve. So there's nerves throughout your entire body, and we have to make sure that we're going into a muscle. We're not anywhere close to bone, because near bone, we've got a lot of nerves. And then pain at the injection site. This is particularly true in our puppies and kittens. If you ever do an IM injection in a puppy and kitten, they have over exaggeration of what just happened. And that's normal. Usually the pain is limited and it goes away. So if the puppy or kitten screams bloody murder, assure the owner, especially if the owner's present, it's going to probably subside. Give it a couple minutes. Usually it's just minimal pain. Any of you who have ever been vaccinated, with, say, a flu vaccine, or, maybe the new COVID booster, whatever we're vaccinating with, that's going into our muscle. And you're sore for a little bit, and it tends to be okay. All right, so how do we want to do this? I want you to wash hands and wear gloves. That's what textbooks say. And unfortunately, in every single one of these videos, you're going to see that nobody wearing gloves. But I'm here to tell you the perfect thing is to wash hands and wear gloves. We really should be wearing gloves more in veterinary medicine. One, it helps prevent diseases from being passed from one animal to the other, but it also protects us. There are certain diseases. Leptospirosis is a pretty popular and widespread disease here in the United States. And guess what? You can catch it from an animal. And while we think about urine to oral contact, guess what? Animals have pee and poop probably all over them. I do know people who have pet dogs just with their bare hands and gotten lepto. So wear gloves, people. Just wear gloves. We should be wearing gloves for every one of our veterinary patients. But I know we don't, but you should be. You need to restrain the animal appropriately. And what does that mean? I'm all for the less fearful movement. I like treats. I like cookies. I like trying to desensitize to animals. But I'm a veterinary technician specialist in emergency critical care. I don't have time to desensitize an animal to an injection that I have to give it because it needs a laceration repair. So do your best, but restrain them appropriately. Insert the needle into the muscle at about a 45 to 90-degree angle. Here's what causes less damage and less risk. No movement. You should go in nice and smooth. You're going to pull back on the plunger. I want you to pull back on the plunger and check for blood. This is to make sure we didn't accidentally hit a vein. There are veins throughout your whole body. You know this to be true because if you've ever gotten a paper cut, it bleeds. There's veins all throughout your body, including in the fingertips that you have. And that's true for our veterinary patients too. So for dogs and cats, they have veins all over their skin and everything. We want to pull back. If we see blood at all in the hub, you stop, you come out, you change the needle, and then you find muscle and hopefully not vein again. I've actually never had blood come in the hub, but it's always safe. It's an easy thing to do. And then you want to inject at a moderate rate. And ideally, throughout this whole quick procedure, your animal doesn't move. So let's show some videos, okay? So we've got a little beagle here. We are not wearing gloves, please note. We have not put any alcohol on, please note. Yep, I know what textbooks say and I know what the reality is. All right, so let's go ahead and push play. We're going into the lumbar, the epaxial muscles. So we're going to do the L technique, pull back, perfect, inject at a moderate rate. And again, making sure our patient doesn't move is really important. So I'm going to play that one because it's so beautifully done. I really like how they really check, pull, go in, nice 90 degrees, come out, and inject. Beautifully done. All right, that's fantastic. That's a great injection. And again, I apologize that I don't have any of the other IM injections. The only other one that I would have is probably in the butt end, right? The semi-membranous or the semi-tendinous area. That's probably the only one I would have because the other two I told you, I don't really do triceps. I don't really do the quadriceps or whatever the heck that muscle bed is in the front of the femur. I've never done that. Triceps, maybe I've done it on a rare occasion, but honestly, at this point in my career, 90% are going into that lumbar muscle area. And then the other of it is going to be in the butt area. And I'm sorry I don't have a butt area injection, but it's the same principle. You're just, again, pinch off the femur, go in at 90 degrees, no less than 45, pull back on the plunger, and then go ahead and go again. All right, here's again what this looks like. We've got another dog. We're doing the L technique. Here we go in. Beautiful. Ooh, doggy didn't like it. I do love how we quickly restrain to make sure the patient doesn't move, which is really important. Now, sometimes we can overly restrain. Oh, let me pause before we get to that next video. I love this. If you can distract your dog with some type of food, and listen, a lot of times when we're doing IM injections, they're getting induced into anesthesia, and this is not practical. So, again, sometimes we just have to get it done. Like that dog that you just saw, those two dogs, they were getting induced under anesthesia so they could have spays and neuters. But if it's something that we can go ahead and do, say it's an antibiotic or something like that, that we can do and give them food, give them food. This is what's called a licky mat. Huge fan of desensitization. All right. So sometimes we can overly restrain, and this is the point of this. And so first of all, I am a huge fan of not scruffing cats. And let me just be very clear. I used to scruff cats. In the 1990s, when I graduated from school, all we knew how to do was scruff cats. We no longer scruff cats because we've learned that they actually cause a higher fear and aggression response. And so, for that reason, we want to keep our kitty cats more distracted. Now, there is such a thing of overly restraining, and this is an example of this. So, I would prefer have how we are holding this cat's head totally fine. We can also do a towel wrap. I would do a lot of ear scrunching. I would love ear scrunches in cats. All right, so kitty cat. Whoa, I'm going to pause. You all can see the issue here. We're overly shaking the cat. We're about to stick a needle into the lumbar spine and or not the spine, sorry, the muscle. And I want to also point out, let me grab my laser pointers just so you guys can really understand. Okay, so we have the vertebrae coming down, and what she's doing here, and this is another method, she's not doing the L method. Instead, she's putting her fingers against the actual vertebrae so she knows where they are. And then she's using her other finger to feel the muscle bed. So she knows exactly where she's going, which is another perfectly acceptable technique. Here we go. She's like, can you not shake as much? Now we have lighter shaking. Pull back and inject. Okay. So yes, very good job on everybody's part. So I really do hope this helps you because for me, understanding how to give injections intramuscularly is super important. But again, making sure you have a good mentor in your hospital. So the first couple are really done under supervision. If you have any questions, please reach out to me. This is my website. So if you have any questions, please reach out to me directly. But also, if you're not a subscriber, you should be. This is the cheapest online continuing education website there is. And here's the coolest thing about this online CE platform. Every single piece of content is created by veterinary technicians and veterinary nurses. And yes, here's the even cooler thing about this. If you're a veterinarian, all the content on here is race approved for not only technicians, but doctors. That's right, doctors can learn from veterinary technicians. I'm super proud of this fact because it is the only website like this. So please, if you're not a subscriber, please subscribe. I run discounts all the time. And if you ever have any questions, reach out to me. I hope you enjoyed this video. Thank you for all that you do.